And the three things that I found to be uh, most impactful on my education was women's health, children's health, and healthcare systems in general. And I chose to research maternal mortality when we were talking about women's health. And I found it really interesting that about 830 women are dying per day. And these women that are leaving newborns behind, their newborns are facing a 46 times greater risk dying within 1 month. And the crazy thing to me was that all these deaths, these women's aren't, they're dying for no reason. Most of the maternal mortality deaths are preventable through education or through healthcare professionals being there. And that was so disappointing to realize that people are just dying and they didn't need to. And then for child marriage, when we were listening to presentations, that was another thing that just really stuck out to me. How 1/3 of women are being married before their 18th birthday in developing countries, and they're having their rights taken away. They feel isolated, leads to teen pregnancy, have a greater risk of HIV and AIDS. And then the thing I thought was the most impactful to me was 31 million girls are out of school. And if these girls that were in school or out of school received a secondary education, it would reduce child marriage by 64%. It would drop the births before 17 by 59%. And this was just crazy because our women support families, they make decisions. They're huge with children's education and children's health, and that's really important for the global aspect. And then I took this in a fact too because I need to realize when I'm working as a healthcare professional how important a mother's life is to their children and just to their family aspect. And then led me into children's health, how 60 million children school age are not receiving education. And I read this story with the wars, how this one girl saw her father die right in front of him, and how this other girl, the war kept going into her like town, and then one thing she was lost from another. So then she lost like her mom, and then she lost her education, and then she lost her friends, and then she was just isolated at her home, and it was just continuing on for years and years, and that was what her life was. And then the child labor with a big chocolate story. I don't even like chocolate, so that was okay. But it was just crazy to read. Like I couldn't get the image of the machete, the kid holding a machete, out of my head, thinking about just a child working like that or holding a weapon in a sense like that. But it wasn't new to me. When I went to Puerto Rico for a mission trip, I gave this boy a water gun to play with, but he thought it was a real weapon, and he told me he was going to protect his family because his dad abandoned them when they were young, and so now he has to be the man of the house, and he has to work for his family, and he like put it away like a real gun, and I was just mind blown. I've never seen that before, and I just couldn't wrap my head. He was 8. He was 8 saying this. Like, you should be worrying about playing with friends. And it was saddening. I quickly grew up in that moment. And it's definitely impacted me now. I have a total different view, and I'll carry that throughout. But our children make up like they're our future. They make up half of the 900 million people living in a world that live on less than $2. And they're the minds of the future. Like I said, they need to have that best education, that best health to make our world a better place in the future. And I need to realize that again as a healthcare professional, how important our children are to our world. And that led me into the healthcare systems. Our children are women, they need better health. They need better access to healthcare. And then I learned more about like the Affordable Care Act, how the differences between Medicare and Medicaid, how Medicare is more of a state and federal system, and Medicaid is that 65 and up, and how it's helped people and how it's kind of split. But then things are changing with the new government, so it's kind of different. But what really opened my mind was the Sick Around the World video comparing comparing other countries to the US, and this is just so disappointing. I love how people are like, the US is this great country, and then we're like so poor in our healthcare. And I was so like angered by this, and I was so intrigued at the same time. I decided to write an English paper about it for a few months, and I just did more research, and I found how interesting it was that we're so focused on the government staying out of our lives, and we're so focused on being the best country, we can't admit that something's wrong. We can't admit that other countries are doing it better than us to change. And it's really important in the world because nobody should know or wonder what's going to happen when they get sick. No one should worry about having to pay for surgery that's going to save their lives. It's that security, that safety that everybody deserves, and healthcare can do that for those people. And I realized how important this was when I was doing my job shadows and mentorships. These doctors or nurses, like, have to change how they treat people because of the coverage they have, and that's not how it should be. And I don't want to be a healthcare professional worrying about the treatment for my patient because of money. No one deserves that. And I realize that this all comes back together. Everybody needs to pursue for the rights of women, children, men, everybody. We all need to work together to pursue and persevere as one. Because if we don't do that, we're not going to get better as a country. We're not going to get better as a world. Our women are going to die. Our children aren't going to grow up with moms. They're not going to grow up with education. And then when they get sick, they're not going to have health care. So I am excited to pursue in my college career global health and psychology. Because of this class, I want to do better. I want to be better. And I thank you for that. So thank you, Ms. Guron.